Well, SURMOUNT-MMO, as you know, builds on a whole SURMOUNT program, really looking at the effects of tirzepatide in various patient populations in obesity with and without diabetes, and has been shown to have remarkable impact on weight reduction, diabetes control, and many, many other outcomes. But we really need a cardiovascular outcomes trial. At the end of the day, we've got this 4 million deaths in obesity in patients who are struggling with this condition. And the major cause is cardiovascular events. And so we really, really have to look at this. Now, of course, this means that it's a huge trial and it will run for some time to accumulate the number of events that we need. But that was the whole rationale for now putting it all together and performing this cardiovascular outcomes trial. Very importantly, the first one to include not just a secondary prevention cardiovascular population, but a primary prevention one too. So I'm sure you've heard of SELECT, which was a semaglutide cardiovascular outcomes trial in patients with obesity without diabetes, but those were patients with established cardiovascular conditions. SURMOUNT-MMO will look at both patients with established cardiovascular disease and those at risk but without established cardiovascular disease yet. So this is really addressing the huge population of patients with obesity without diabetes who are at risk of cardiovascular outcomes. So, of course, in SURMOUNT-MMO, we want to address the primary hypothesis, and that is that tirzepatide compared to placebo will reduce the primary composite outcome. And this time we chose a 5-point composite MACE, and that is all-cause death, non-fatal MI, non-fatal stroke, coronary revascularization, and heart failure. Now, we also want to look at, of course, a myriad of other outcomes, including traditional 3-point MACE and the impact on things like new onset diabetes, in the outcomes that impact all kinds of other organ systems that we know are affected by obesity, kidney outcomes, liver outcomes, and so on. What we really, really want to see, of course, is as well whether this works just as well in a secondary prevention population as in a primary prevention population. We know that patients with obesity are at risk of a myriad of bad outcomes. And in looking at cardiovascular outcomes, it's become clearer and clearer that they're at risk, not just of the atherosclerotic outcomes, but also heart failure outcomes. So we're incorporating all of this in a 5-point MACE and choosing to look at all-cause mortality as well as a truly hard objective endpoint. That's a great question. So first, we have to admit that we don't know the exact extent to which the effects of tirzepatide or other GLP-1 receptor agonists are related to weight loss versus some other effects. With tirzepatide, there is ample evidence of non-weight loss benefits. For example, in improvement in insulin sensitivity, impact on biomarkers, such as, really beneficial effects on the lipoproteins. Tirzepatide has been shown to reduce hepatic and visceral fat. We know that beyond obesity as measured by a body mass index, adiposity as measured by visceral fat is so important, right? And a reduction in visceral adiposity, even if body mass index doesn't change, is extremely important. There's anti-inflammatory effects, a whole slew of evidence for other types of effects. And so it's definitely, I for sure think that there are non-weight loss mechanisms involved. So SURMOUNT-MMO is going to address a population of patients with cardiovascular outcomes data not addressed in other trials. I think that's one major point, and that are patients with obesity, no diabetes, and no established cardiovascular disease. So a really primary prevention population. So that's going to be very key. Now, in the secondary prevention population, we do need more data. SELECT results were very impressive, and that's great. But this will provide even more outcomes data. And I truly believe that the field needs this because knowing, for example, that these therapies actually save lives and prevent hard outcomes will really cause us to take this seriously, see obesity as a chronic condition that is treatable, and not just is treatable, must be treated to improve outcomes for these patients.